I want you to think about something. Somewhere in your home right now, in a drawer, a filing cabinet, an old medical folder you haven't opened in years, there's a piece of paper. It might be a hospital discharge form. It might be an old blood donor card. It might just be a handwritten note from a doctor's visit decades ago. On that piece of paper are two characters, a letter and a symbol. And those two characters may be the most underused piece of biological intelligence you have ever possessed. I am not talking about blood type the way diet book authors talk about it. I am not talking about the wellness influencer version, the one that tells you to eat more red meat if you are type O and avoid tomatoes if you are type A. That version is oversimplified to the point of being nearly useless. I am talking about something different. Something that took researchers analyzing data from hundreds of thousands of patients across multiple decades to uncover. And what they found is this. Your blood group leaves a measurable biological fingerprint on how your cardiovascular system ages, how your brain holds up under pressure time, how your immune system responds when it's tested, and, if you're not paying attention, what is statistically most likely to compromise your health in the years ahead. But here's the part that should make you stay until the very end of this video. Every blood type has a hidden vulnerability, a quiet biological tendency that develops slowly below the surface, invisible on the standard test your doctor runs at your annual physical, until one day it isn't invisible anymore. And by then, years of compounding damage have already occurred. Today I am going to walk through every blood type, O, A, B, and AB, and for each one I am going to tell you a thing that most physicians never have time to explain. The specific risk that your particular biology is quietly building toward after 60, and the targeted interventions, not generic wellness advice, but specific actions matched to your blood type that can change that trajectory starting now. And I am saving the most important piece for the very end, because there's a modifier that sits on top of every blood type letter, a variable that most people have never thought about for even 5 seconds, and it changes your personal risk profile in ways that matter significantly. Let's begin. Before we go any further, drop a comment below and tell me your blood type. Oh, AB or AB. Knowing yours will make everything that follows feel personally relevant rather than abstract. Type O is the oldest blood type on the planet. It is the most common, carried by roughly 45% of the population, and for the vast majority of human history, it was a powerful survival blueprint. Type O blood appears to have developed within our earliest ancestral populations, people whose survival depended on physical endurance, a strong immune response to parasitic threats, and a digestive system capable of handling large quantities of animal protein under demanding conditions. The biology that helped those populations survive for hundreds of thousands of years is still running inside type O bodies today. And in the modern world after 60, that ancient design has a very specific cardiovascular advantage. Type O individuals circulate lower levels of von Willebrand factor, a protein that plays a central role in blood clotting. Lower clotting activity means smoother blood flow, less tendency for platelets to clump together, and a statistically lower risk of the arterial blockages that lead to heart attacks and ischemic strokes. Multiple large-scale studies across enormous patient populations have confirmed that type O individuals carry a meaningfully reduced risk of coronary artery disease compared to those with blood types A, B, and AB combined. That is genuine good news. Real, documented, biologically grounded good news. But here is where the story takes a turn that most conversations about blood type completely skip past. That cardiovascular protection can quietly become a trap. I have watched this pattern play out in clinical practice more times than I can count. A type O patient in their late 50s comes in. Blood pressure is fine. Cholesterol is within range. No significant family history of heart disease. And because everything connected to the heart looks clean, they stop paying close attention. They dismiss fatigue as just getting older. They push through digestive discomfort without investigating. They assume that because their cardiovascular profile is strong, their overall health is strong. That assumption costs some of them dearly, because type O's most serious age-related vulnerabilities are not in the heart. They are in the digestive system. The stomach lining of a type O individual expresses specific surface receptors that a bacterium called Helicobacter pylori is particularly well equipped to attach to. H. pylori is not a dramatic pathogen. It does not arrive with intense pain. It does not announce itself through fever or obvious illness. It moves in quietly, establishes itself in the gastric lining, and over years and decades, it systematically degrades a protective mucosal layer of the stomach. Left undetected and unaddressed, this progression follows a well-documented path, from low-level inflammation to chronic gastritis, from gastritis to peptic ulcers, and in a meaningful percentage of cases, from ulceration to gastric cancer. Gastric cancer caught in its advanced stages is one of the more difficult malignancies to treat successfully. Gastric cancer caught early, when it is still localized, has dramatically better outcomes. Type O individuals also show a measurably elevated risk of peptic ulcer complications serious enough to require surgical intervention compared to other blood types. This is documented across multiple epidemiological datasets. It is not theoretical. So if you are type O and you are over 55 and you have never been evaluated for H. pylori infection, that is the single most valuable conversation you can initiate with your physician this year. The testing is non-invasive, a stool antigen test or a simple breath test. It is inexpensive. And for type O individuals specifically, it is not routine caution. It is biologically targeted prevention. Now here is your practical framework going forward. Your gut is your primary vulnerability. That means protecting the gastric lining with consistent intention. Extended use of nonsteroidal anti-inflammatory medications, ibuprofen, naproxen, aspirin, erodes the stomach lining in everyone. In type O individuals, that erosion lands on tissue that is already operating at elevated biological risk. If you use these medications regularly for arthritis or joint pain, that conversation with your physician needs to happen. Incorporate fermented foods into your regular eating pattern. Kefir, miso, kimchi, naturally fermented vegetables. These are not trendy wellness additions. For type O individuals, they are practical tools for maintaining a gastric environment that is more resistant to bacterial colonization. On the physical side, your body was designed for movement. Type O blood is associated with higher baseline activity in the catecholamine system, dopamine, and norepinephrine. When that neurochemical energy has no physical outlet, it converts into restlessness, fragmented sleep, and over time, dysregulation of the cortisol system. 30 minutes of daily walking combined with 2 sessions of resistance training per week will do more for your long-term metabolic health than nearly any supplement protocol. Type O, your cardiovascular resilience is a genuine biological inheritance. Your stomach is the system that requires your active attention. Do not let the strength of the first lead to complacency about the second. Before we move on, tell me your name and where you're watching from. I read every comment, and I genuinely want to know who I'm speaking with today. Type A is the blood type, where the gap between what people know and what they should know is wider than any other. Type A blood emerged as human populations transition away from nomadic hunter-gatherer life and toward agricultural settlements, denser communities, more complex social environments, and exposure to a broader and more varied landscape of infectious agents. The immune system adapted accordingly. Type A individuals developed a powerful and precise immune response, particularly effective against viral pathogens. In youth, that is a genuine biological advantage. But this is where blood type biology becomes genuinely complex, because what protects you at 35 begins to work against you through a completely different mechanism by the time you reach 60. Type A blood carries elevated coagulation activity. The platelets are more reactive. The clotting proteins are more active at baseline. A landmark study out of Harvard tracking close to 90,000 adults over a 20-year period found that type A individuals carry a statistically elevated risk of coronary heart disease compared to type O. That number sounds modest in isolation, but here is what makes it clinically significant. It does not exist in isolation. Type A individuals also maintain the highest baseline cortisol levels of any blood type. Cortisol is the body's primary stress hormone. In short, controlled bursts, it is essential. It sharpens alertness, mobilizes glucose, prepares the body to respond to challenge. But when cortisol runs chronically elevated, week after week and month after month across years, it produces a very specific change inside your arteries. It inflames and progressively stiffens the endothelium, the thin inner lining of your blood vessels. And here's a mechanism that matters most for type A men and women. When the endothelium is inflamed and less elastic, it becomes a surface that reactive platelets preferentially adhere to. Do you see what is happening? The elevated platelet reactivity of type A blood and the chronic cortisol-driven inflammation of type A physiology are not two separate, independent risk factors. They are a compounding loop. Each one amplifies the danger of the other, and that loop runs every single day for decades before it produces a visible event. For type A individuals, stress management is not a quality of life consideration. It is direct cardiovascular intervention. It belongs in the same clinical conversation as blood pressure management and cholesterol monitoring because it is addressing the exact same underlying pathway. If you are type A and over 55, having your blood pressure checked every 6 months rather than annually is not excessive. It is appropriate monitoring for your specific biological profile. Ask your physician to include homocysteine in your next blood panel. Homocysteine is an amino acid that, when elevated, actively damages arterial walls. Type A individuals trend toward higher homocysteine levels, and the corrective intervention is remarkably accessible. Adequate folate, vitamin B12, and vitamin B6, dark leafy greens, eggs, legumes, and lean proteins. Straightforward, inexpensive, and specific to your biology. And build a daily cortisol reset practice. Not a monthly retreat, not a Sunday yoga session. Something that happens every morning before your day accumulates its demands. Clinical research on diaphragmatic breathing. For seconds of inhalation, 6 seconds of exhalation, practiced consistently for 10 minutes has produced measurable effects on cortisol regulation. The consistency matters far more than the duration. 5 minutes every single morning outperforms an hour once a week by a meaningful margin. Type A, impressive immune capability. Elevated cardiovascular risk driven by a stress hormone that your blood type keeps persistently elevated. Managing that hormone is the most important health decision you will make this decade. If you're following along and finding this useful, type the letter A in the comments right now. It tells me who is watching and what is resonating. Type B is the blood type that conventional medicine understands the least, and mainstream wellness culture tends to oversimplify the most. Type B emerged among nomadic populations traversing the vast interior of Central Asia and the Himalayan highlands. People whose survival required constant metabolic adaptation to new food sources, new climates, and new biological threats encountered during continuous migration. The immune system that developed out of those conditions is genuinely remarkable in its range. Type B individuals can process a wide variety of proteins, fats, and complex carbohydrates with a degree of metabolic flexibility that other blood types do not consistently demonstrate. That adaptability is documented and real. In the context of our evolutionary history, it was a profound advantage. But here is the clinical vulnerability that most type B individuals over 55 are living with and not connecting to their blood type. Type B carries a distinct immune signaling profile. And what the research consistently identifies is that the modern food environment creates particular friction for that system. Studies confirm that type B individuals show a measurably different gut microbiome composition compared to other blood types. And certain dietary inputs that have become dominant in the modern food supply, refined seed oils, highly processed foods, high fructose corn syrup, appear to trigger stronger systemic inflammatory responses in type B individuals compared to other blood types. The immune system of a type B individual is designed for adaptability, but adaptability requires accurate environmental inputs to function well. When the inputs are consistently inflammatory and low quality, that immune flexibility begins to operate less like a strength and more like a hair trigger. The result is low-grade chronic inflammation, the kind that runs below the threshold of obvious symptoms for years. Persistent fatigue that doesn't fully resolve with rest. Joint discomfort that seems disproportionate. Digestive inconsistency. A general sense of the body running harder than it should to maintain baseline function. These symptoms are frequently dismissed as normal aging. In many type B individuals, they are not. They are signals that the immune system is chronically activated and needs a trigger identified. If you are type B and have been managing these kinds of symptoms with lifestyle adjustments while accepting them as inevitable, a direct conversation with your physician about inflammatory markers and autoimmune screening is worth initiating. Early identification of chronic inflammatory conditions changes the treatment trajectory significantly. Your C-reactive protein level, a standard marker available on a routine blood panel, should be monitored at least once a year. A consistent CRP reading above 1 milligram per liter in the absence of an active infection is a meaningful signal. It means your immune system is running in a chronically activated state, and finding the trigger before it finds you is the goal. For exercise, Type B physiology responds better to sustained moderate-intensity movement than to repeated high-intensity training cycles. Swimming, cycling, hiking, and consistent daily walking help maintain a stable inflammatory baseline. High-intensity interval training that generates sharp spikes in inflammatory markers during recovery can be counterproductive for Type B individuals, particularly over 55. Type B, the most metabolically adaptable blood type on the planet. Keep that immune system precisely calibrated, and it is one of your greatest biological assets. Allow it to run chronically activated without identifying the trigger, and it becomes one of your most significant vulnerabilities. If this is helping you connect dots you've been wondering about, fatigue, inflammation, symptoms that feel unexplained, hit the like button right now. It helps this kind of research-grounded information reach people who are quietly dealing with the same things and not getting answers. Type AB is the youngest blood type in human evolutionary history. It appeared relatively recently, in biological terms, when populations carrying Type A and Type B antigens began mixing at scale. And because of that dual inheritance, it carries an immunological profile unlike any other. On one side, Type AB inherited the immune tolerance tendencies of both parent blood types. AB individuals tend to mount lower inflammatory responses to certain environmental antigens, which translates into meaningfully reduced risk of some gastrointestinal malignancies and certain gastric inflammatory conditions compared to other blood types. That immune tolerance is a real advantage. It is worth acknowledging, but it comes with a cost that the research has made increasingly difficult to overlook. Type AB individuals carry a statistically elevated risk of cognitive decline, including vascular dementia, compared to Type O individuals. The mechanism is cerebrovascular, and it operates over a timeline long enough that most people never see it coming. Type AB blood inherits elevated coagulation factors from its component. Over decades, these factors contribute to subtle but cumulative changes in perfusion of the brain's smallest blood vessels, the microcapillaries that supply the regions most responsible for memory consolidation, processing speed, and executive function. These are not dramatic blockages that produce sudden events. They are microscopic, incremental reductions in blood flow efficiency across neural tissue, changes that accumulate silently for 15 or 20 years before they manifest as anything noticeable. By the time the effects are visible in cognitive testing, the underlying vascular process has usually been building for a long time. This is why, for Type AB individuals, cardiovascular health and brain health are not two separate conversations. They are the same conversation. Blood pressure control, blood glucose stability, cholesterol, and triglyceride management. Every intervention that protects your arterial system is simultaneously protecting your cognitive function. They cannot be separated. DHA, the long-chain omega-3 fatty acid found in fatty fish like salmon, sardine, and mackerel, is incorporated directly into the cell membranes of neurons. It maintains the membrane fluidity required for efficient neural communication and reduces the neuroinflammatory signaling that accelerates small vessel disease. 2 servings of fatty fish per week, or a pharmaceutical-grade fish oil supplement discussed with your physician, is not optional for Type AB individuals over 55. It is targeted neuroprotection based on your specific biological profile. Sleep is the other non-negotiable. During deep sleep, the brain's glymphatic system, its internal waste clearance mechanism, activates and flushes out accumulated metabolic byproducts, including the protein aggregates associated with neurodegeneration. Consistently sleeping under 6 hours impairs this process significantly. For Type AB individuals, chronic sleep restriction is not merely a fatigue issue. It is accelerating the exact biological vulnerability your blood type already predisposes you to. 7 to 8 hours every night. Not occasionally, consistently. This is your most powerful and most accessible daily intervention. Type AB, exceptional immune tolerance. A brain that requires deliberate, consistent, long-term protection. And that protection needs to begin now, not at 70 when the effects of decades of compounding are already visible. If you are still here and this is landing, type "it helped" in the comments. I genuinely read them, and knowing what resonates shapes the content I produce next. Before we close, there is one final variable that nearly every blood type discussion leaves out entirely, and it matters: the plus or minus symbol at the end of your blood type designation, Rh positive or Rh negative. Approximately 85% of people are Rh positive, meaning they carry the Rh antigen on the surface of their red blood cells. The remaining 15% are Rh negative, and this difference is not a minor technical footnote. Rh negative individuals appear to carry a modestly different cytokine signaling profile. Cytokines are the chemical language through which your immune system communicates with itself, the signaling molecules that coordinate inflammatory and anti-inflammatory responses. When that signaling is calibrated differently, the immune system's threshold for activation shifts. The emerging research on Rh negative individuals suggests a heightened sensitivity to certain inflammatory triggers. The practical implication: if you are Rh negative, regardless of your primary blood type letter, the anti-inflammatory protocols outlined in this video are more relevant to you, not less, and should be implemented with greater consistency. For women who are Rh negative, if you are currently pregnant or anticipating pregnancy and your partner or baby may be Rh positive, this is a medically critical conversation to initiate with your obstetrician proactively. Rh incompatibility during pregnancy is entirely manageable, but it requires timely medical intervention. The intervention works. The window for it matters. Know your complete blood type, the letter and the sign. Make certain your physician has both on record. Here is the most important thing I am going to say today, and it is a thing most blood type discussions deliberately avoid. The statistics are real. The risk elevations are documented. The biological mechanisms are genuine, and none of them are your destiny. I have seen type AB patients in their mid-70s with cognitive sharpness that surpass colleagues 15 years younger, not because their genetic risk profile was somehow different from what the data predicted, but because they understood what their biology was working against, and they built their daily lives around addressing it directly. They slept 8 hours. They ate fatty fish twice a week. They kept their blood pressure consistently below 120/80. They kept learning genuinely challenging new things, not passive scrolling, but real cognitive engagement that built and maintained neural complexity. Their statistical risk was still present. The biological predisposition still applied to them. They simply chose to meet it with intention, rather than allow it to accumulate quietly in the background. The distance between genetic predisposition and actual health outcome is not small. It is enormous, and it is filled entirely by decisions made consistently over years. That gap is where your choices live. Your blood type is not a verdict. It is a map. And a map has only one purpose: to show you where you need to navigate carefully so you can get where you want to go. Now tell me something. What is your blood type? And does the profile I described today reflect what you have actually been experiencing in your own health over the past several years? Drop it in the comments. I read everyone, and what comes up consistently in this community directly shapes the topics I cover next. If this video gave you something useful, there's another one linked below where I walk through 3 most commonly missed root causes of persistent fatigue and elevated blood pressure in men and women over 55. Conditions that are very addressable when caught early and almost always mismanaged when they are not. Take good care of yourself. You have been carrying this body for a long time. It is worth understanding exactly how it works.